Hello, Namaskar, good morning, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals directly to this live show where you can ask questions and queries. You're welcome to ask your questions. You can post your question in the chat box of YouTube channel. You must be watching this on the Facebook or you must be watching this on the Instagram. But if you want your query to be answered, you know where to type in your question, YouTube chat box, and I shall place these questions before the expert. And also, it will be helpful if you download Apollo 24/7 because we're going to give away gift vouchers and discount coupons towards the end of the show. And also, if you participate in the health quiz in this session, I'm going to ask you three simple questions. You can also win prizes, and you can win prizes which will be credited to your Apollo 24/7 account. So go ahead, download your Apollo 24/7 app, and here we go with our topic for today. Skin allergies. What are they? What are the rashes, dermatitis boliye, or any kind of other allergies boliye? We all struggle from them at some point, right from birth to elderly. Everybody suffers from a skin allergy at some point. How serious are they? What are the signs, diagnosis, and treatment? We're going to talk about this topic today. And today we are having Dr. D.M. Mahajan, who is a senior dermatologist at Indraprastha Apollo Hospitals, New Delhi. Sir has more than 35 years of experience and he's been here on Apollo 24/7's Health Hour earlier as well. And he specializes in the treatment of various skin and hair conditions such as, cystic acne, psoriasis, alopecia, vitiligo, rosacea, and skin cancer as well. Non-invasive anti-aging treatment, which includes, Botox, melasma treatment, threads, fillers, hair restoration, and hair transplant as well. Sir has memberships in Indian Society of Aesthetic Medicine, Indian Association of Dermatology and Laser, and Indian Medical Association as well. Let's welcome Dr. D.M. Mahajan. Sir, namaskar. Welcome back.
Namaskar.
It's always good to have you, sir. I remember the wonderful session that we did almost a year ago, and we were talking about how leprosy, we were doing a major episode on leprosy and psoriasis as well. So it's always good to have you back because people like you, such seniority and with experience, it's very difficult for people to access unless they have a physical condition to come and see you. But these programs give an access for us to meet you and chat with you to share the experience that you have gained all these years. So it's a pleasure, Doctor.
It's my pleasure entirely. And all these topics have been very close to my heart. Every day, people come with various mysteries in their mind. And it's
Right.
my duty to give them the right solution, not to mislead them. This is very important.
Correct. Wonderful, doctor. And I respect you for the kind of integrity that you hold while you treat patients with sensitivity. Huge respect to you, sir. Thank you so much for honoring us again on a Sunday morning. We understand that you're very busy with your works and you have graced us with this time while you're being busy with a personal event as well. Thank you again. So I know I've done a vote of thanks, but let me get into the topic. Our audience are waiting. So sir, allergies, जैसे मैं इंट्रोडक्शन में बोल रही थी बचपन से लेकर right from the birth, a simple rash or a red bump can start to show up and create so much of panic. And what can be called an allergy of a skin? Is it just the skin which is showing up, or are there any other physiological or internal reasons for this allergy to show up?
That's a very good question in the sense that, right, the days I was a child, any infliction of the skin, any affection of the skin was thought to be allergy. At one time, anything associated with the skin was thought it is untreatable because allergies are very difficult to get rid of. And so, as the evolution occurred in the field of dermatology, lots and lots of uh, things came to the light in the sense that how the various conditions are being produced. So, allergy remains one of the foremost areas where a lot of research has been conducted, and it
Gee.
has led to very fruitful results in the sense now we know the causes of various things which we used to dump them straight away, in a dustbin diagnosis as a allergy, and treating them the look, they are untreatable, they will keep on going on, because it's normally seen that allergy
Yeah.
is a condition which needs the allergens to be get rid of from the environment. Only then you get rid of the allergies, but no longer. Our body does react. So allergies basically is very misused word in the sense that anything we do not understand, we label it as an allergy. और इसमें बहुत दो चीजें बड़ी notable are there, that because skin is a very long organ, the largest organ, तो कोई भी चीज उसके टच में आएगी, it will produce reactions in the two forms. One is a irritant reaction, which is very very common actually.
Right.
I mean, like आंखों में धुआं लग जाए, it causes redness. So that is an allergy, we treat it. No, it is not allergy. It is basically an irritant reaction. Like you wash
Ah,
your hands too often, especially the young
okay.
moms, who's been with the kids. They have to wash quite often, and then it results in a very sort of drying of the skin and very battered skin, and we label it allergy. No, it's an irritant dermatitis. So the major chunk is irritation contact dermatitis. The lesser chunk is the allergic dermatitis, and in which we do have various subsets also. So as we grow it better in the talk, I'll be elaborating what
Sure.
all are the
Thank you.
allergic conditions.
वंडरफुल डॉक्टर. सो इट्स इंपॉर्टेंट टू अंडरस्टैंड कि सब कुछ एलर्जी नहीं होता है. एलर्जी का वो एक ब्रैकेट टर्म है, वो अम्ब्रेला टर्म की तरह यूज किया गया है, बट दैट माइट नॉट बी एक्चुअली ट्रू इन मोस्ट केसेस. सो हियर्स अ क्वेश्चन. रंजन त्रिपाठी जी है, 50 साल के हैं, मेल है, suffering from skin allergies, rashes, red spots almost every morning, inflammation and burning. इन्होंने मुझे कुछ और दिया नहीं है कि डायबिटीज है या क्या है इनका, कुछ हमारे पास नहीं है. बट रैशेस आर द मोस्ट कॉमन फॉर्म दैट दे appear, द रेड स्पॉट्स और द रैशेस. एंड अगर ये डेली होता है तो इज देयर समथिंग दैट दे नीड टू वरी?
It shows कि skin एक part है उसका manifestation का. There is something going on inside their body which is being reflected in the form of rashes, and that too once in a daytime, say especially in the early morning. And
करेक्ट.
for any skin conditions, four I's are very responsible. The alphabet I am talking of. I
ऑलराइट.
for infection. Infection, I for infection. Any trivial infection in the body, I mean, howsoever, maybe a trivial cold or trivial sneezing, or a little stomach upset, or little loose motions, slight fever, can result into a rash. So is true about like any rash can be because of another eye, means infestation means any worm in the body also can result in a skin rash. Eye for immune related. Now this
ओके.
forms one of the trickiest things nowadays, which is occurring in majority of the things. So any thing causing an immune reaction in the body can result into a rash or an urticaria or a dermatitis, in that sense. And I is ingestion. Ingestion
इंजेक्ट.
means khana. Either it can be in the form of drugs or it can be a normal food also. They can also result into the reaction to the skin or the allergic rash. Say many foodstuffs such as very most incriminated is the Ajinomoto in the Chinese, what we really put in. Anything having a lot of preservatives, the canned foods, which have a big shelf life also, can lead to the rash also. Any fragrance also can lead to the rash. And so is true about any drug, on the earth. And the worst thing is, right now, we do not have any test to prove that this drug can cause a reaction. There's an
Yeah.
irony. The only way to prove is to give this drug, and if it produces rash, it means a person is allergic to it. We call it a challenge test. And
Oh.
the only treatment for such cases is the withdrawal of the drug. So we do have a good classification of various allergies. What do they cause to the skin? Like right from a perennial times, this is occurring, such as eczema, psoriasis, so many things. They were labeled as allergies now. No longer now. It is more of inflammatory reactions, which can
Correct,
affect
correct,
any system of the body.
correct. So,
I think the very word allergy made me go overboard. Sorry, I've been over elaborating, but then yes,
नो
in
डॉक्टर,
nutshell,
आई
I was
आई
very
एम ट्राइंग टू अंडरस्टैंड. सो जब ये 50 साल के रंजन त्रिपाठी साहब बोलते हैं कि रैशेस एक एक टाइम पे आते हैं कि इनका इन्फ्लेमेशन भी है, तो कारण आइडेंटिफाई करना इम्पोर्टेंट है. सो ऑफ द
बिल्कुल
आईज दैट यू हैव.
आइडेंटिफाई है. जी, 4 आइज़ यू हैव टू आइडेंटिफाई अमंग दीज़ 4 आइज़.
राइट.
इन्फेक्शन है इनकी बॉडी में और इन्फेस्टेशन है, इम्यून है और व्हाट इट इज़. और वी कॉल इट अर्टिकेरिया, रिकरेंट अर्टिकेरिया. We need to know
राइट.
the cause so that we get rid of it and his problem gets solved. Or it can be a indicator for a systemic infection,
ओके.
of one of the first few signs of the systemic infection also. So it needs a little deeper probe. You can't dismiss as an allergy in the morning allergy only. Morning is
ओके.
the worshipping time, so why allergy?
सर, अगर रंजन त्रिपाठी साहब कुछ टेस्ट करवाने हैं उनको, या किसी को कंसल्ट करना है, डू यू थिंक द डर्मेटोलॉजिस्ट इज द फर्स्ट गेटवे, और जनरल फिजिशियन इंटरनल मेडिसिन शुड चेक हिम आउट फर्स्ट?
जी, आई थिंक डर्मेटोलॉजिस्ट क्योंकि स्किन रैश है, it is very important कि let him go to a dermatologist. उनसे
करेक्ट.
देखें, अच्छी तरह से दिखवाएं अपने आप को. और अगर
जी.
डर्मेटोलॉजिस्ट ये उचित समझें तो he can be shown to an internist also
Sure,
for any
doctor. Thank you
systemic
so
infection.
much. Right. The next question I would want to take is Miss Arshia Fatima, 39-year-old female. Sir, what helps to get rid of fungal infection completely? And this recurs.
Fatima, the major problem occurring with the fungal infection है कि हर कोई फंगल इन्फेक्शन इनडिस्क्रिमिनेटली ट्रीट कर रहा है. थोड़े टाइम के लिए हम लोग मेडिसिन खाते हैं, उसको ऊपर से नजर आता है कि ठीक हो गया, बट अंदर से वो रहता है. और
Ah.
दिस इज रिजल्टेड इन द फॉर्म ऑफ अ वेरी रेजिस्टेंट इन्फेक्शन. So the existing medicines, they have been rendered ineffective, as well as the duration needs to be modified, the other conditions of the patient need to be modified. The in gist, you need to be treated very properly. A right drug needs to be used for an adequate amount for an adequate period of time, along with the local ointments. So there is no
Correct.
reason why it should not respond. But then it seems you have not been treated properly.
सो हियर आई अंडरस्टैंड डॉक्टर महाजन कि ये जो ट्रीटमेंट का विंडो होता है, प्रोटोकॉल होता है, वो हम लोग एज पेशेंट्स और एज पीपल गेटिंग ट्रीटमेंट डू नॉट adhere to it, and that's one of the problem.
बिल्कुल आपने ठीक कहा. I mean,
हाँ.
moment itching stops, we think disease खत्म हो गया. No,
No.
just the trivial symptom is gone. Doesn't mean कि जो है the root thing has been treated. No, it is not.
ग्रेट. सो जो आपको आपके डर्मेटोलॉजिस्ट ने बताया है फातिमा जी, प्लीज कंटिन्यू एंड कंप्लीट योर एंटायर कोर्स. यू विल बी infection free after a while. It's not immediately, but after a while. Thank you. So next question I would want to take is Vikram Vaibhav. Age is 56. Is there any medicine for melasma in face? मैंने आपकी प्रोफाइल भी पढ़ा है कि आप मेलास्मा को ट्रीट करते हो. यू हैव सर्टेन मेजर्स दैट यू अप्लाई इन योर क्लिनिक. Can we elaborate on them, sir?
देखिए, मिलाज्मा इवन हम लोगों के लिए भी एक बहुत बड़ा एनिग्मा है.
अच्छा.
Overtly, it looks very easy to treat, but the main problem with melasma is its recurrence, high rate of recurrence. ऊपर
Right.
से, I mean, we are able to clear the pigmentation part, but to treat it from the root is really very, very difficult. So we also, in this case, need to treat it for a longer period of duration. And in between, once the remission is there, we need something to maintain the melasma free zone also. And then
Okay.
Certain measures such as peeling and the charcoal Q switch and other laser aids also help to reduce the recurrence rate. I can't promise a full cure. Anybody today who discovers the full cure will be a multi billionaire. It's such an enigma also.
Absolutely, sir. But sir, इतना ओवर द काउंटर मार्केट है जो वल्नरेबिलिटी को मार्केट करता है कि क्योर करता है या वन ट्यूब और वन क्रीम वन एप्लीकेशन विल ये तो इट्स जस्ट एनकैशिंग अ वल्नरेबिलिटी.
लोगों की सेंटिमेंट्स एनकैश कर रहे हैं. जस्ट बी फूलिंग पीपल, नथिंग एल्स.
That's it. So
नो
do not
मेल.
believe Vikram Vaibhavji, as Sir has said, they will try, and there are intermittent relief periods before it comes back. But cosmetic reasons के लिए आपको करवाना है तो please do consult Dr. Dave Mahajan. हम लोग link छोड़ेंगे sir की consultation की. So one question about melasma that I
No,
want to
one,
continue.
I want to add one thing before we wind
जी
up
sir.
this melasma. Do not get tempted to use steroids, local steroids. They
This
are a
was about.
quick fix,
I was about to
but
ask the
then
same.
you land up into more trouble. You'll end up into
Yes.
more trouble after using the steroids locally. So, not at all, do not use steroids at all for melasma.
फैंटास्टिक डॉक्टर. आई वाज अबाउट टू आस्क यू कि इतना सारा डेस्परेट हो जाते हैं एंड so is there any serious complication that melasma can lead to, or do I need to worry about it, or is it just a cosmetic, it doesn't have any more serious effect to it?
Because melasma, the way it expresses itself as a rash, it is very important that we delineate it, whether it is really a melasma or a something similar other rash, which can be discoid lupus erythematosus, which is an autoimmune
Oh,
infliction of the skin, with can in due course of time affect the systems, various systems of the body in the form of SLE or systemic lupus erythematosus.
lupus.
So,
Oh,
one, you need to differentiate between melasma and this butterfly rash known as a DLE. Other conditions such as sarcoidosis, many other conditions mimic melasma. But it is very important that we first make sure that it is melasma without any systemic part, and then we handle it accordingly.
great. Sir, one quick question continuing the skin. हम लोग सोचते हैं कि ये काफी सारा कॉस्मेटिक देखने के लिए अच्छा होना चाहिए, इसलिए हमें एक्ने रैशेस कुछ भी होना नहीं चाहिए. But is there any condition which is life threatening, which is indicated due through the skin or appearance of rashes? Are they serious conditions?
Yeah, we do see with the skin full of rash, which is life threatening. One particular is the pustular psoriasis.
हाँ.
It amounts to the third degree burns. The whole body is involved into that, and one tends to lose so many good nutrients and electrolytes and water from the body because skin का barrier function गड़बड़ कर जाता है. So
जी.
skin stops functioning as a good barrier to protect the water from being evaporated within the body. And as you know, water is very important for the upkeep of the body and the day-to-day regime. Other
जी.
conditions are the drug rash also. This also, I have seen conditions which are life-threatening in the form of
जी.
erythema multiforme or Steven Johnson syndrome or toxic epidermal necrolysis. पूरी बॉडी से जैसे ऊपर की परत उतर जाती है. एंड इट इज, आई मीन, आई वर्क इन अपोलो हॉस्पिटल, एंड देन अदर डिसिप्लिन्स के जो हमारे डॉक्टर लोग हैं, दे गेट शॉक्ड. दे हैव अ बिलीव कि स्किन के डॉक्टर्स के पास इतने सीरियस केस नहीं आते. दे गेट शॉक्ड एंड देन दे फील टू मच ओवरऑट कि यार आप लोग कैसे ऐसे लोग हैंडल कर लेते हो. यू गॉट अ रियल courage, because whole of their body is devoid of upper layer of the skin. So it is very worse kind of a burn kind of a look. it gives.
So to
And other
to
conditions such as a pemphigus also, autoimmune disorder. There are plenty of such cases. I can
G.
only
So now
enumerate one or two.
G. G. So now I understand that your skin rash, which seemingly simple ho sakta hai, can lead to something which is more dangerous and life threatening as well. So let us be careful in identifying it and continuing your treatment. सर नेक्स्ट क्वेश्चन में नवीन कुमार यनमल्ला 28-year-old मेल है. इनको फोटो सेंसिटिविटी एंड पीएमएलई है एंड एनी रिलीफ दैट यू कैन सजेस्ट.
Look, this is a very seasonal problem, and then I can only say that your body is programmed to develop a polymorphous light rash in response to the light exposure or the sun exposure, or maybe, the exposure what I'm getting at the moment from my computer. Also, that also matters in such individuals who are much predisposed to develop this. So we should not discount I mean, we work 12 hours in a day over the computer. Yes, computers do emit 10% of the radiations what the sun emits. So you should not dismiss it. So use a sun cream even, before you start working over your laptops or computers. That's also important. So for such light sensitive people, it is important that we give them a skin hardener in the form of hydroxychloroquine as well as a frequent use of sunscreen. Now, the proper use of sunscreen is very, very important. It's not an eye wash. Look, just smear a little dab of sunscreen on your face and you
जी नॉट.
think you are protected from the sun. No. One, the sunscreen has to be physically present on the face and on the all exposed areas. Irrespective of the face, also, you have to, in addition, apply it over your hands, over your feet if they are exposed. So, this we don't take into the account, we only try to protect the face only, whereas light can get into the system from other exposed areas. Then,
जी.
being in India, very sweaty conditions, we wipe it, so the sunscreen is no longer there. So it effects is not there. So you need to replenish it also. So the ideal dictum is that you apply on your face at least 2 fingers of amount of a sunscreen every 3 hourly during the daytime. It is very important. The adequate quantity of the proper sunscreen is very important to protect yourself from the sun. And try to use goggles. James Bond and all those never had any photosensitivity. Hats, protect. So in a
जी.
day-to-day activity, it's very difficult that you have to keep indoors. It becomes very difficult. Idea is to retain all your normal functions.
All right. Great, sir. So somebody who has photosensitivity will understand, or person living around with a person with photosensitivity will understand how difficult it is to get on with day-to-day activities. Ji Naveen, please do take care of yourselves. Dr. Mahajan has given wonderful bits of information there. So next question है, kids learning, age is 31, back acne है और pimples भी है face पे. सो ये बैक एक्ने के बारे में एक और क्वेश्चन भी है. एस महापात्र एज 35 फीमेल IgE 1939 persistent allergies on the back. Dermatologist gives deep moisturizer but it recurs. These are two different questions but I thought back acne एक ही बार डील कर लेते हैं.
Look, back acne is an offshoot of our facial acne or the
अच्छा.
chest acne. We call them a truncal acne. Now, in our day-to-day practice, we do see a lot of usage of corticosteroids as oral medication.
जी.
So, in many of such cases, we do see a back acne. This is one of the common expressions of overdosing of the corticosteroids use. So, one should ensure that the persons in questions are not taking corticosteroids for a long period
G.
and not using the steroid preparations also. At the same time, we do have this is an offshoot of the facial acne. So in many people, the acne on the face do not occur, but in absence of any other evidence, the back acne do occur. The same glands which occur on the face are there on the back of the skin. So it's total
Yeah.
programming again. I mean, one good suggestion I give them: look, do not use too much of massage oils or something, and also treat it. Look, from a boy you're becoming a man. So it's a part of the growing up process. So
Acha.
do not be too much worried with this thing. So use an antiperspirant daily on the back. That also helps to reduce the acne and helps in their resolution also. But do
Great.
find out a cause.
थैंक यू सो नेक्स्ट सीक्रेट गेमिंग इनका नाम दिया नहीं है और नीस का एज भी दिया नहीं है सर नीस इज हैविंग एटोपिक डर्मेटाइटिस फ्रॉम चाइल्डहुड इज इट ट्रीटेबल
Very difficult thing, but I must say, over the years, I've learned that in atopic dermatitis, many don'ts are more important than do's. Like you avoid certain things, your atopic dermatitis does not get totally ameliorated, but then, yes, its intensity goes down. Its recurrent attacks, they really go down. And the most important are one, the food allergies also. You need to know that you have a lactose intolerance or any other intolerance or any canned foods and other things, with the colored food material, try to avoid. Any preservatives you try to avoid. Like out in the West, the peanut butter is very, very much responsible. I mean, kids eat and they do develop. In our country, it is much less, but nonetheless, it does exist. And so is true about in our day-to-day life. Soap and water exposure is one of the worst things which can worsen atopic dermatitis
so how do we
because
find
already
out
you have.
creating this so do I do a test like ये इसको मैं remove करती हूँ देखती हूँ add करती हूँ देखती हूँ how do I understand
Yeah,
sir
yeah, you rightly said the withdrawal test. At the same time, we do have another test known as a patch test.
G
So we apply this and then take the reading. Various allergens we put on the back and then take a reading after 48 hours. And accordingly, the wheels or the other things produced, we measure and then we get to know you. It is likely to produce.
Cool. So, and a personal question here that I would want to add. My daughter had colored food coloring के लिए जो substance use करते हैं, उसके साथ we found out that she was developing the dermatitis rashes all over, and we pulled that out, and she was quite fine. Now that she's grown up into a 21-year-old girl, she's not reacting as much. So, will it grow out of the age, or has the body understood it differently?
Look, in majority of the cases of atopic dermatitis, it settles
Acha.
after attaining the adult age. It does settle, but in very few, say 2.5%, it does continue. As such, per se, it continues.
G.
So it has its own course because your immunity system develops as per your
So
contemporaries also.
So your eye, one of the eyes has a prominent. Of the four eyes,
Yeah,
immunity has.
out of the four, eye will be always there. One eye will always be there.
Right, doctor.
So eye for
But
an eye.
yes, doctor. विप्लव महाराणा जी पूछते हैं सर विटिलिगो का ट्रीटमेंट है क्या एंड somebody else also was asking about vitiligo let me put all their questions lip vitiligo के बारे में कौन पूछ रहे थे नाम याद नहीं yes Rashi Rastagi and Biplav both of them are asking about vitiligo and you know vitiligo is something which काफी सारा implications you know social implications भी हो जाते हैं so one brief because we can't continue a lot that itself will take an hour more to talk about So quickly an overview of vitiligo.
Uh, I must say in one line that vitiligo is a very, very unpredictable disorder.
G.
One, it has more of a cosmetic ramifications, then systemic issues, like it is seen many a times with thyroid and immune disorders, or the other autoimmune disorders, or some vitamin B12 deficiencies. But we do not know the cause yet fully, what is really causing the disease. So its treatment also remains an enigma. But the sufferer, I know the agony in their mind, they must know, look, इधर उधर नहीं जाना. Many people, they tempt you, look, this is treatable, this is curable. So you must differentiate the two lines. One, it is treatable but not curable. So these are
Okay.
two very different words. So इसका treatment अभी बिल्कुल भी नहीं बना है. Yes, certain cases में हम इसको reverse कर लेते हैं. Like if you come early in your evolution of vitiligo, or we get to know certain causes, or a little younger age, and you do not suffer from any atopic dermatitis or other immune lowering disorders, yes, there are chances of reversing it. जैसे आई बात लिप विटिलाइगो की, one thing is there that it is very, very difficult to treat any part of the body which is devoid of hair. You get repigmentation with lot of difficulty. You must make it very clear in your mind that any melanocyte or the pigment cell, once destroyed, never gets regenerated or reproduced. Whatever pigmentation we get, yeah. You're going to ask
सर
something?
विप्लव जी पूछ रहे थे कि इनका एज 27 है, जो लिप विटिलिगो के बारे में पूछ रहे थे। तो नाउ डॉक्टर सेइंग लिप टैटू करवाएं, इज इट सेफ?
नहीं, उसमें जो टैटू में, कैन यू गिव मी 1 सेकेंड? वन
श्योर,
सेकेंड आई टेक.
ठीक है डॉक्टर। So I see a lot of people are asking about questions. That I'm going to take up questions like Katawal ji, Krishna Kitur ji. I'm going to take your questions very shortly. Um, and yes, Surajit Gun ji, you are asking important questions. I'm going to take those questions as well. Yeah.
या आई एम
Uh,
बैक. या
yes, doctor. Thank you so much. So, Doctor
या
Saab, we were talking about the lip tattoo. विप्लव जी पूछ रहे
या
थे विटिलिगो के लिए करवा सकते हैं क्या?
देखो, lip tattoo में one is very important. One thing that as I was elaborating कि जिस भी स्किन के ऊपर हेयर नहीं हो, उसके ऊपर दोबारा से पिगमेंटेशन आनी very, very difficult. He must be very clear in his mind. Secondly, I know your social constraints are there, forcing you to get the tattoo, the vitiliginous part. I must tell you that you should ensure that there is no progress of the vitiligo lesion for at least a period of 2 years before you embark upon the pigmentation by tattooing, because vitiligo is known to increase by any trauma, और टैटूइंग के अंदर ट्रॉमा होता है. कोई नीडल प्रिक हम करते हैं जिससे पिगमेंट ट्रांसफर करते हैं, इट कैन फर्दर वर्सन देयर टैटू. So minimum 2 years of steadiness of the rash, and then there should not be any Kubner's phenomena. What I just told you, कि इंजरी वाले और हिस्सों में अगर इनके वहां भी वाइट पैच आ गया तो इनको नहीं कराना चाहिए. So just get the things cleared, only then you think of getting a tattoo.
G. Wonderful suggestion. I think Viplav, you have a great answer here. Just take care of yourselves. So next question that I want to take is Katawal official. Wife is breastfeeding mother right now. Last 3 days she has some redness in both the legs and hands and itching bhi hai. 31-year-old mother hai. No other symptoms. So, in I have seen in a lot of breastfeeding mothers or new mothers that they do develop a lot of sensitivity, itching, and rashes. I myself had gone through certain issues, especially in my stressful days, that I used to break out into itching and rashes. Any connection, sir?
Uh, what I understand, there is no systemic cause that why you should develop redness and itchiness in the hands and feet. The only thing which comes to my mind is that the kid being small, the frequent washing and handling the soap and water leads to the irritant dermatitis at both the places. So I think she should take care of this part कि जो भी कुछ करना है, start wearing gloves and then handle the soap and water issues or frequent bathing or frequent cleansing or whatever the other things are there.
ओके ओके। पर ऐसा भी बताया जाता है कि अपने जो बड़े बुजुर्ग घर में होते हैं, ये बताया गया थे मुझे कि ये डिलीवरी के बाद वाता पित्त कफा में वाता बहुत ज्यादा हो जाता है, दैट्स द रीजन यू हैव दिस। तो उसके ऊपर कोकोनट ऑयल लगवाया, नींबू लगवाया, जिसके साथ बहुत ही जल गया मेरे हाथ। And then I started to itch even more, and then I scratched even more. So, जो घर के नुस्खे हैं, will they even help, or sometimes they might also worsen the condition? What are
They
the
worsen,
things that
yeah.
yeah, what are the things that I can do at home and should not be practicing at home?
Like already, though the skin was totally irritated. So by using lemon water or bathing it with other soaps, it adds from worse to worse. So it is important कि सबसे पहले तो उसका irritation part should be eliminated. Like use of gloves and other things are very important. Plus, a very good frequent moisturization is very important because
जी,
of the frequent washing and other things. The oil of the skin is drenched away and it needs to be replenished by using a very good moisturizer. Say, especially water in oil base kind of preparation. Ointments will be much to use. And then घरेलू नुस्खों में जैसे एलोवेरास and others are very good to be used in day to day practice.
एलोवेरा लगा सकते हैं, ठीक है सर। थैंक यू सर। नेक्स्ट कृष्ण किटूर जी हैं, 75 ईयर ओल्ड मेल, डायबिटिक है, DM2 है, अंडर कंट्रोल है, बट स्कैल्प में बहुत ही ड्राइनेस और इचिंग है। तो आई डू नॉट यूज कोकोनट ऑयल और एनी अदर ऑयल। आई ट्राइड डिफरेंट शैम्पूज बट आई डोंट हैव रिलीफ। काइंडली एडवाइस अ रेमेडी एंड हाउ टू टेक केयर ऑफ द ड्राई स्कैल्प इन दिस एज।
What's the age group?
75 sir।
Oh, yeah, quite already. So skin is much
Delicate।
depleted with the oil. So one thing is important for her to know that we always feel, look, we got a dandruff, so we oil it. So we make it even worse by putting on oil. The best course is that whatever the serum which is being desiccated over the skin needs to be removed by frequent mild shampoos. So frequent mild shampooing will definitely help her a lot. And then later on she can use some tar preparations.
सर ये
Some
जनाब
tars are there.
हाँ, काफी ऑयल यूज नहीं करते हैं, एंड दे ट्राइड विथ
Yeah.
मल्टीपल शैम्पूज, तो
Yeah.
ज्यादा उनको रिलीफ नहीं मिली है।
I mean, ask her to use this thing,
अट्टा
steroid
शैम्पू,
preparation. Yeah,
स्टीरॉइड।
topical steroid. Yeah.
जी, ओके डॉक्टर साहब। ओके, नेक्स्ट क्वेश्चन दैट आई एम स्काउटिंग फॉर इन द मीनवाइल। सो नेक्स्ट क्वेश्चन इज सूरजीत बुइन जी पूछते हैं, इन्होंने एलर्जी पैनल टेस्ट करवाया है, बट उनमें से काफी सारे फूड के लिए स्टार डबल एक्स आए हैं, इनका मतलब क्या है, और मुझे एलर्जी किससे, ये कैसे समझें?
ये जो टेस्ट हैं दे आर वेरी डिफिकल्ट एक्चुअली नाउ इन वीवो और इन विट्रो। आई मीन जो बॉडी के अंदर वो चीज रिएक्शन करती है और जो बाहर हम टेस्ट करते हो करती है उसमें आई मीन मेनी अ टाइम्स दे आर फाउंड टू बी dissimilar. So if you get a testing done, they will show hundreds of things you are sensitive to. I mean, to which overtly your body does not take. So they have little place in our practice.
राइट सो मैं भी आपने पहले भी रिट्रेट किया था कि एलर्जी पैनल टेस्ट आर नॉट फॉर एवरीबॉडी एंड शुड नॉट बी डन ओवर एंड ओवर अगेन जो आपको स्ट्रेस में भी डाल सकते हैं लास्ट टाइम आई वेरी वेरी वेल रिमेम्बर दैट यू सेड बेकार में पैसा खर्च मत करो ये बोला था आपने
Yeah,
सो
absolutely. I still remain my status. Yeah.
ठीक है सर थैंक यू सो मच या सो अगर इनकी इनको कुछ और समस्या है आर देयर एनी अदर टेस्ट दैट ही कैन टेक
नहीं, वन मस्ट नो कि किस वजह से इनको आ रहा है बेसिकली, द वेरियस कॉजेज, द वेरियस ब्लड टेस्ट कैन बी ऑफ मोर यूज, से
जी
atopic dermatitis है or other infections in the body or infestations.
ठीक है so do consult your dermatologist and take a proper test which is not the allergy panel test but you can take other tests which can actually show what you have so next question is Ayman Ansa 26-year old है and chikungunya आया है इनको very recently and I had serious rashes burning sensation itching and red spots doctor has given me steroids but after that there is swelling in the body सर ये जो वायरल फीवर्स के बाद रैश होता है जो एसोसिएट होता है फीवर्स के साथ इनको कैसे और कितना देर तक ट्रीट करना पड़ता है
तो वायरल फीवर के बाद जो रैश होता है, यू नीड टू ओनली ट्रीट सिम्टोमेटिकली,
अच्छा
because this is one of the common accompaniment of a viral fever, like anti-allergics, antihistamines, and calamine lotion and cold water compresses. Do not overtreat. It
राइट
settles.
इट सेटल्स डाउन सो जो फीवर के साथ रैश निकलता है स्पेशली चिकनगुनिया और
Sorry?
डेंगू
Yeah.
yeah so at
Hmm.
that point do I have to worry about the skin rash or just continue with the viral fever treatment
Yeah, continue the viral fever along with
that's it
anti-allergics. That's all. Yeah.
that's
Symptomatic
it.
treatment.
All right. Thank you, doctor. Next is Saran Ramaswamy. They live in Arizona, USA में रहते हैं. While they were in Chennai, they did not have any skin issues. But now they have psoriasis and I'm applying cream to it. If I stop the medication, can I stop the medication? What diet would you suggest? And when can I stop taking the medication?
Psoriasis, as we all know, is a very chronic disorder.
G.
Very heartbreaking disorder. So it is caused by the immune reaction or the inflammation in the body only. Is an autoimmune reaction. The one only thing which comes to my mind after listening to his story is that he was in Chennai, the things were better, and now in Arizona they are worsened. It is a place like Chennai is hot and
Humid.
humid. It helps in the resolution of the psoriasis.
Arizona is dry
Where
and desert.
Arizona, yeah, and Arizona is dry and cold climate worsens it. It's known to really aggravate the psoriasis. So that seems to be the same explanation. Yeah.
Ah, so it's not about your medication or your creams. I think, Sagan, you need to rethink about the location that you live because this is going to be your skin condition for life, and maybe you should take a decision along considering your condition. I think that's it for Saran. Next, sir, ये विजय प्रभाकर जी है जो जिनको दिया गया एक टैबलेट जो है बिलांटा ट्वाइस अ वीक इचिंग के लिए मुझे दिया गया है ये मैं कितने दिन कंटिन्यू कर सकता हूँ परमानेंट क्योर होता है क्या
अब अगेन इचिंग का आपको कॉज आई मीन जानना बहुत जरूरी है. Many a times it is seen that the worse come worse, these antigens जो itching produce कर रही हैं, they have a life of 120 days. One, at the outset, I must say कि bilastine dose has been very improperly given to you. It should be given minimum 20 milligrams every day before a meal for this period. Every day it should be given, not twice in a week. So it is a very subnormal dose. It is ineffective. It's just, eye wash what we are giving. So ask him to take it one tablet every day before meal, and then see for himself after 2 weeks how the things stand. And then in the meanwhile, try to get to know of the cause of the itch also.
Yes, doctor. Thank you so much. And next question that I'm moving on to is uh, Bahadur. ये इनको फंगल इन्फॉर्मेशन रिंग वर्म है एंड किडनी प्रॉब्लम्स भी है, आईजीए नेफ्रोपैथी भी है. तो ये फंगल इन्फेक्शन के लिए जो भी मेडिकेशंस लेते हैं किडनी कंडीशंस को कैसे ध्यान में रखें?
देखो, जो भी फंगल इन्फेक्शन के लिए खाने की मेडिसिन लेते हैं, इसको ध्यान में रखना जरूरी है कि मैनी आर किडनी को टॉक्सिक करते हैं. इनको किडनी इन्फेक्शन तो है ही ऑलरेडी. क्या इनकी किडनी कॉम्प्रोमाइज्ड है? व्हाट वी कॉल इट अ सीकेडी और अ क्रॉनिक किडनी डिसीज, ऐसा है क्या? सो ये
आईजीए
चीज बड़ा
नेफ्रोपैथी.
ध्यान में रखें कि कोई भी ऐसी एंटी फंगल है जो नहीं है, जो कि किडनी को नुकसान नहीं पहुंचाए. तो ये चीज ध्यान में रखें और अपने नेफ्रोलॉजिस्ट और डर्मेटोलॉजिस्ट को जरूर मिलें, तब कुछ लें इसके बारे में.
जी, जी. थैंक यू सो मच फॉर दैट वार्निंग सर, बिकॉज़ इट मेक्स अ लॉट ऑफ हम जाने अनजाने में कभी खा लेते हैं एंड किडनीज आर द वंस व्हिच टेक द brunt of it. So thank you sir. Manmeet Singh Anand, I'm suffering from chronic allergic urticaria since last 10 years and get hives and needle-like pain in winters when in sun or body temperature raise hota hai to. I have taken many allergic tablets under dermatologist's guidance. बट ये क्रॉनिक कंडीशन है तो कैसे ये रिलीफ कर पाएंगे इतने सालों से जो सफर करते हैं?
देखिए, कई बार ये अर्टिकेरिया काफी मुश्किल हो जाता है ट्रीट करना, इवन हम
जी.
लोगों के लिए भी. तो पहले तो कोशिश करें इसका कॉज जाने, आपने डर्मेटोलॉजिस्ट से मिले, इसका कॉज जाने. अगर कुछ कॉज निकल जाए तो प्लीज रेक्टिफाई इट. और some autoimmune disorders or other skin systemic disorders, they also manifest as urticaria over a long
जी.
period. So get your
जी.
body screened. Plus, इसके साथ साथ emalizumab and so many things new have come up in case it is a case of chronic spontaneous urticaria. So then you start using it. But better consult your dermatologist. He will be the best help for you.
Right. I know it is difficult for you. You've been consultation, but yet do not give up. The journey is tough, but yes, you will find some hope. Sir, Anshu Chopra hai. Next question. Allergic to pollen and dust for many years for now. Sneezing is major. It comes up as sneezing. Now I also see that it shows up on my skin. I'm advised to take cetirizine daily to avoid itching all over my body. Is it okay to continue it for a long term?
Yeah, cetirizine over a long term can be used, but then yes, again, what I said, do not use any medicine indiscriminately. Try to find out the cause. कि क्यों sneezing हो रही है आपको? If the cause is there, please treat the cause, not the symptom. जैसे एक बुखार है, fever है. I mean, you get to know whether it is typhoid, caused by typhoid, malaria, or what, and then treat. Not the crocin alone will not help. It will only subdue the temperature part, the symptom, but not the culprit.
सो इनको अभी इन्होंने ऐड किया है सर कि इनका ऑलमोस्ट 20 साल से एलर्जेंस ने आइडेंटिफाई कर लिया है, जो है डस्ट, पॉलन, पीनट्स, लेमन. तो बस इनको दूर रखने से काफी हो जाएगा सर?
नहीं, इफ ही इज 100% श्योर कि इन चीजों से होता है, तो इनका वो बन जाता है, वैक्सीन बन जाता है. ही कैन ट्राई दैट. मेनी अ
अच्छा.
टाइम्स इट वर्क्स.
ओके. सो प्लीज डू कंसल्ट डॉक्टर डी महाजन का लिंक भी हमने छोड़ा है. यू कैन, इफ यू हैव नोन आइडेंटिफाइड triggers that can be taken care of. Right. So winters and rashes. Valayapati Rajgopal. During winter, I'm getting rashes and itching on my skin. Is it normal?
It is dryness, I think, more caused by the winter. low ambient humidity causing dryness, and in turn we scratch. In turn, it produces a rash. So it is a itch
जी,
scratch cycle which produces a rash. So
हाँ,
make your skin supple and soft and nice.
ठीक है, राइट, थैंक यू। एंड नेक्स्ट क्वेश्चन सर, रसिया ब्रिजवासी, मेरे बेटे के नाक, 7 साल का बेटा है सर, इनका नाक पर मस्सा हो गया है, कृपया मार्गदर्शन करें सर। व्हाट इज मस्सा? आई डिड नॉट अंडरस्टैंड।
नाक पे मसा, either it is a wart or a mole.
अच्छा,
So
सात
both
साल का
needs to
बच्चा,
be removed. It can be removed if it is not too big or something. Can be removed in the OPD procedure. उसको रिमूव
ओपीडी पे
करा
भी?
दें आप। हाँ,
अच्छा,
अगर वॉट
रिमूव
है तो
करके,
तुरंत
हाँ सर,
करवाना है उसको। या
अच्छा, सो ये बच्चा है फिर भी करवाएंगे और ओपी में भी करवा
बिल्कुल।
सकते हैं?
या इन्फेक्टिव मटेरियल है, इट विल मल्टीप्लाई अननेसेसरी।
ओह, ठीक है,
इज हर
तो आप
ह्यूमन
रसिया जी,
पैपिलोमा वायरस,
अच्छा,
HPV
एच
इन्फेक्शन,
एचपीवी
ह्यूमन
के वजह,
पैपिलोमा वायरस। या
एंड वो बच्चों पे भी होता है सर?
बिल्कुल, एनीबॉडी विद अ लो इम्यूनिटी, इट्स एन अपॉर्चुनिस्ट।
ओके,
आई मीन जैसे कैंसर के लोगों को भी काफी हो जाते हैं जिन, क्योंकि उनमें इम्यूनिटी स्टेटस इज compromised. So it's true about HIV people or any extreme of ages. See, small kids, very small kids, and the very old people. They have low immunity levels. It does
ओके,
happen. It's an
तो दी आई,
opportunist overpowered.
ठीक है सर। सर, पद्मावती दामोदर जी है, एचसीसी पेशेंट सिंस 2 इयर्स। एचसीसी मुझे समझ में नहीं आया, बट एचसीसी पेशेंट है, कीमो टैबलेट्स यूज किया है, बट उनका प्राइवेट पार्ट इचिंग एंड रैशेस हैव फॉर्म्ड आफ्टर द कीमो। व्हाट कैन आई डू? एंड काफी सारे लोग हैं जेनाइटल इचिंग के बारे में पूछ रहे हैं, so do we also have to take care of a dermatological advice or any other advice that you would suggest?
No, in the private areas.
Yes sir.
Yeah, the main is again the fungal infections, the low grade fungal infections. I mean, that does develop a habit of scratching, and then it is very difficult to break this habit. So
जी,
get it totally treated and keep the sort of things hygiene proper and keep it dry. I always advise the patients in the hot climates use a
जी,
hair dryer on a cold mode.
जी,
On a cold mode, hair dryer on a cold mode is very
गुड,
effective.
या सर, तो ये जो एचसीसी पेशेंट है, कीमो टैबलेट्स यूज किया है उन्होंने, एंड देन उसके बाद में प्राइवेट पार्ट में इचिंग शुरू हुआ है, इनका कुछ मसला सॉल्व कर
Again,
सकते
the
हैं?
opportunist infection coming up on those
हाँ,
areas. The fungal are one of the opportunists. Candida and fungal there. So show himself and then treatment.
हाँ, हाँ, तो ये जो फेस वॉशेस के बारे में काफी सारे लोग पूछ रहे हैं कि ड्राई इरिटेटिंग स्किन है, इवन आफ्टर द फेस वॉश फेस बिकम्स इरिटेटिंग एंड रेड स्पॉट्स, सो फेस वॉश बदलना है या बस मॉइस्चराइजर? कैसे मॉइस्चराइजर चूज करें? रम्या नागराज इज ऑल्सो आस्किंग
Moisturizer.
दिस।
Yeah. Moisture has to be parabens and sulfate free. I mean, preservative free is very important. Cleanser first, so you should have a good cleanser
जी,
which does not leave your skin dry. So the cleansing and moisturization are one of the very two important steps in the skin preservations and its
जी,
function. So take care with that. And the moment you apply a thing, you feel good. It means that suits you. The very common way I explain to my patients is if you feel comfortable and you want to repeat it again, it means the thing is quite acceptable to you. I mean, it fits well on your face. So kindly
या,
do that.
श्योर डॉक्टर। सो टू लास्ट क्वेश्चंस क्विकली आई वुड वांट टू टेक वन। साई संप्रीत है, 24 ईयर ओल्ड है, सेबोरिक डर्मेटाइटिस है, रैशेस ऑन द नेक टू हिप with full of black spots. Please suggest any medicines or relief.
Rashes on
सर,
neck,
रैशेस नेक से हिप तक है सर।
neck से hip तक है. I mean, it's in continuity or in some certain areas only affected.
షూర్. సంప్రీత్, ప్లీజ్ హైదరాబాద్ నుంచి అన్నారు కదా, మీరు డాక్టర్ గారు అడిగినది కనుక విన్నట్టయితే ప్లీజ్ డూ టెక్స్ట్. ఈజ్ ఇట్ ఇన్ కంటిన్యూస్ గా ఉందా, కొన్ని ప్లేసెస్ లో మాత్రమే కనిపిస్తుందా అని అడిగారు. డూ టెక్స్ట్ బ్యాక్. బట్ సెబోరిక్ డర్మటైటిస్ कैसे appear होता है sir? What is it like?
The seborrheic is only the activity of the glands, seborrheic glands. I
अच्छा.
mean, they're producing the abnormal sebum or the abnormal quantity of the sebum.
जी.
So
जी.
it is caused by that. But then many conditions mimic seborrheic dermatitis. Say
जी.
one another is a macular amyloidosis, which is itchy and that scratchy, and I think it could be one of those. Yeah.
All right. So he's not yet texted back, sir. But in the meanwhile, I'll take Mr. Ranjan's. Chennai से है, Rajesh Raja है, 36-year-old है. He had a fungal infection under skin, under arms and inside the thighs. He had taken medications and creams, but the black mark is left over. Will it go?
Yeah, if the fungus has been adequately treated and no longer there, it will be in sooner or later he will get rid of this black marks. This is a sign of inflammation. We call it a
Yeah.
post-inflammatory hyperpigmentation.
Okay. Okay. So with Jaiga, that's it. All right, sir.
Yeah.
Thank you so much. And I think with that, I will have to end the questions from the audience. I see last minute joinees, Shampa Banerjee and Jyoti Maurya. Yeah, I can't take Jyoti Maurya's question, but one quick question, sir. Can you please guide how to recognize an allergy if it is due to dust mites?
Very difficult. No way we can pinpoint how to do that. It is just that we give you some ivermectin or something, and then it's very difficult to say it is due
Yeah.
to dust mite.
Yeah.
Difficult.
Okay. So you can't, but then you have to understand that, once you understand that there is. But any test panels that can show, sir? No?
Your test panels show invariably they show the dust mite are available. I mean the positive and all those. Because wherever there is dust, the mite will be there. It's quite a frequented microorganisms, into that.
या या सुधा जी, एसएलई के बारे में सर ने बताया है, वो एलर्जी के अंदर नहीं आता है. यू कैन रेफर टू दी रिकॉर्डिंग लेटर. एंड ज्योति मौर्य जी करंटली फेसिंग बॉल्डनेस है एंड हेवी हेयर फॉल है. प्लीज हेल्प मी विद दिस. सर इज एन एक्सपर्ट इन ट्रीटिंग सच कंडीशंस. हमने सर का लिंक दे दिया है. डू कंसल्ट हिम इन प्राइवेट. यू कैन थ्रू अपोलो 24/7 एज वेल. सो फॉर नाउ आई विल टेक लीव फ्रॉम यू. थैंक यू सो मच फॉर बीइंग विद अस. सो जाते जाते थोड़े टिप्स जो हमारे व्यूअर्स के लिए, टॉप टिप्स प्लीज बता दीजिए.
Well, important is that use simple things. Don't go for too many fancy things. They promise more and deliver less. So our skin is absolutely a marvelous organ unless until you do too many manipulations. It has enough resistance कि अपने आप को बिल्कुल ठीक ठाक रख सके. सो तीन इम्पॉर्टेंट चीज़ें आप ज़रूर देखिए स्किन के बारे में. एक, इसको क्लींजिंग, प्रॉपर क्लींजिंग करना बहुत ज़रूरी है. उसके बाद इसको मॉइस्चराइज करना बहुत ज़रूरी है. और तीसरा जो है कि इसको सन से बचाना बहुत ज़रूरी है. तो इसके लिए सनस्क्रीन वगैरह एक प्रॉपर आप तीनों चीज़ें प्रॉपर चूज करें तो आपकी स्किन आपको कभी भी जो है धोखा नहीं देगी.
Wonderful, sir. Thank you so much. So we understand that you have given us your precious time while being on a holiday as well. We appreciate this and thank you once again for being with us.
My pleasure. My pleasure. Thank you so much.
थैंक यू. सो चलिए, आज आपका बारी है मेरे क्वेश्चंस का आंसर देने का. हेल्थ क्विज इज कमिंग अप. यू कैन पार्टिसिपेट इन दिस quiz while answering it on YouTube channel of Apollo 24/7. You please answer over the chat. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name to be winner, please do write back to us with all your contact details, with phone number, address, etc., with email ID at marketing@apollo247.com before Wednesday of every week. The gift vouchers will be shared with you. And आज के 3 questions है ये आपके screen पर. Fill in the blanks. R से शुरू होता है. R blank, SH blank, E and S can happen for many reasons, including skin infections, allergies, and medications. What is it? We've been talking about it. R से शुरू होने वाला word को आप fill in the blank करके type कीजिए. That's question number 1. Question number 2, true or false में answer कीजिए. An allergic reaction can cause rash, itching, burning, redness, bumps, hives, and swelling. Is that right? True or false? Question number 3, yes or no में answer कीजिए. Allergies are harmless. Yes or no? These are the 3 questions. Go on, type your answers on YouTube chat, and I'm waiting for the winners while our team waits for your answers and picks up the winners. Let me give you coupons, discount vouchers that you can use on Apollo 24/7. The first one that we give you is Ask Doc 150, ASKDOC 150, to consult top doctors direct from Apollo. You get 150 rupees cashback on online doctor consultations when you use this code. And the next one that we give you is First 3, FIRST 3. Order medicines directly from Apollo hospitals and get up to 25% off on online medicine orders. And this is valid on the first 3 medicine orders which are above 1000 rupees, and you get a 2-hour delivery as well. And the next one that we are giving away today is exclusively for our Health Hour viewers. Use the code HH247 to get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. This is in addition with the other coupons that we give away. And you can also access Apollo 24/7 right now with WhatsApp. Do save this number 09355247247. You can avail all the healthcare services with just a text or a call. So that is the WhatsApp number. Do save it. Next week we are talking about gas and acidity. ये तो common है. कितना कॉमन है कि कहीं ना कहीं डेली एक बार तो एटलीस्ट लोगों को खाने में दिक्कत होती है, खाने के बाद दिक्कत होती है. सो व्हाट आर द रीजंस? आई थिंक दिस इज गोइंग टू बी वन ऑफ द मोस्ट informative episode and most participating episode. I will be waiting for you next Sunday 17th of December. हम मिलेंगे 11 बजे on Apollo 24/7 Health Hour. Right now I'm waiting for our winners to be announced by our team. बट नेक्स्ट वीक का टॉपिक नोट कर लीजिए. अगर आपके कोई क्वेश्चंस है दैट यू वांट टू आस्क अस, डू register first only and then type in your questions and send us so that we can take up these questions. So the winners for this week are Bhanu Prakash, Hari and Harminder Kaur. I repeat, Bhanu Prakash, Hari and Harminder Kaur. Please do write with all your contact details and claim your prizes. Thank you all of you, and we shall see you next week. Namaskar.